I'm going to start by palpating a little closer to her spinous processes, not right on them, but just next to them. Yeah, she's getting a little scrunchy face there. Okay, yeah, so she's a couple little jumpy spots there. All right, I'm going to go just a little laterally to that and just see. That's not a big a deal, is there? Is it? Okay, and I'm going to come just a little more laterally. That's not a big deal there, is it?
No.
So in her case, hers is very close to the spine. With some people, you're going to have to go a little more to the side. But, yep, right down in that neighborhood there. Yep, see how she starts making the frowny face? Okay, so that's a good sign, right? I'm listening with my eyes, not just with what she says. Because some people won't say things, they'll just put up with it. So what I'm going to do is I've made contact with that sore spot. Now my finger's just floating on the skin in that spot. The rest of my hand now is going to kind of anchor or catch the skin above it. My other hand, meanwhile, is going to come underneath her neck and connect the skin below it. So we're going to have the sore spot in the middle, and we're going to stretch the skin north and south, above and below it, away from that sore spot. Okay? So my left finger is marking that spot. We can make the frowny face. Part of my left hand is going to catch the skin above it. My right hand slides underneath, and again, it's going to come in and connect with the skin below it. And then now my right hand is going to shift the skin slightly down towards her upper back as my left hand anchors and or slightly tractions the skin up along the back of her neck. So again, how exciting is this? Okay. But if we let the paint dry and let her body do all the cool stuff inside, now when I check, how does that feel?
Doesn't hurt.
Doesn't hurt. Okay. How long did that take?
Seconds.
5 to 10 seconds.
Yeah.
Okay. Typically, most of the time, I'm only going to wait 5 to 10 seconds before I check in with that person by repalpating that spot. You know, if I wait 2 minutes and then palpate and find out that it wasn't working for them, I've just wasted 2 minutes. So if I check in after 5 to 10 seconds, then I've only wasted 5 to 10 seconds, and now I might make a little adjustment, like I did with her. I had to go a little bit further with it, and then it was better. And then I checked in, and it still wasn't gone. And I thought, well, I can make another change, or I can wait. Okay, in this case, we got it right away on the first try, so I can just hang out here, give her body time. Did you notice that little change in her breathing just now? It's like she had. While I was talking here, all of a sudden I felt her just kind of go. Okay, so little stuff like that too. What does that indicate?
Well, change. A change.
What were you saying, Tanya?
Relief.
Yeah. So sometimes I'm not sure what it means, but a lot of times, if it seems like they're just becoming more relaxed, generally I'm going to take that as a good sign. I'm not moving her towards fight or flight. All right, and then I'll ease back out. Okay, I don't ever just fly out of these things, right? Okay, so if I go into it gently, I'm going to come out of it gently. When I press in here now?
No, doesn't hurt.
Fine, okay.
A little lower, it's getting tender.
Yep. So she can still feel like if I press hard enough that I could irritate something further down, okay? I'm going to actually leave that one for your partner.
Okay.
All right, so let's talk about, so there we've address kind of from the occiput all the way down posterior neck. You can just those two things can help you do quite a lot of good. When I find that spot and I use this hand to anchor the skin, I pull this down. Again, everything between the two spots where I'm connecting with her skin to draw the skin in opposite directions, I might be having a positive impact along that whole area, but I'm affecting a large cutaneous field. Everything between my two hands is going to be impacted by what I'm doing. Okay? So, what if it's more lateral neck?